Imagine someone suffering from terminal cancer. They are mentally stable to make their own decision, and they ask you to assist them in suicide. Good afternoon, ladies and gentlemen, honorable judges, and worthy opponents. We, the opposition, strongly agree with this resolution. This House should make voluntary euthanasia. Okay. In this speech, I'll talk about how it is a person's right to live peacefully and how the Hippocratic Oath supports our point. I'd now like to expand on my points. My first contention is that it is a right for people to live peacefully, and who are we to take away this right? These suffering people are aware of their own decision. It is unjust and even barbaric to take away their right. How can a suffering person live peacefully when they're denied the right to freedom to choose whether they want to live or to die, as my partner not now. My second contention is that when a person first becomes a doctor, they sign something called the Hippocratic Oath. The doctors swear that they will not let their patients suffer and die. However, how are the doctors fulfilling this oath if they're letting their patients suffer? Yes?
Okay, you keep mentioning that these patients are mentally stable when they're going to make this choice, but how can they be mentally stable if death lurks right around the corner? That they're just going to die within a minute.
But diseases such as terminal cancer, or AIDS, aren't they still like? What about those diseases where they still have time to think about it? Not now. They're letting their patients die mentally. We shouldn't stop our doctors from fulfilling this oath. As my partner has said, euthanasia is something voluntary, and the patients are aware of their own decision. Yes?
Yes, to expand on his POI, what he's saying is, how can they think properly if they know in a month they're gonna die? How can they still think properly? Because all that's on their mind is that they're gonna die.
How are you sure that these patients are only thinking about how they would die? I'm not sure. Okay. Anyways, now I'd like to rebut some of my opponent's points. My opponent has said that how the love and family, like how they feel if their, let's say, sibling has chosen to choose euthanasia. However, we should also consider about how the family and love will feel if they watch their family suffer. Wouldn't it also cause pain to them? And, yes?
Is it really suffering if the patient is there spending his last moments with his family? Is that truly suffering?
But what about the moments before his death? What if he's suffering from his disease, and then what if he's suffering from his disease and the family and love are watching him suffer? Not now. My opponent has also said that the doctor is breaking the Hippocratic Oath. But how are they breaking the Hippocratic Oath when they are not letting the patient suffer anymore, mentally and physically? Not now. Now let's recap some of my partner's points. My partner has said that every person has a freedom to choose whether they want to live or die. That is a right to choose themselves, and we should not take this right away from them. Thank you.
Good afternoon, honorable judges, worthy opponents, and guests. The resolution before us today reads, this house should voluntarily